trach care, you do the same thing you do before beginning any procedure. You check your orders, gather your supplies, and wash your hands. When you come to the bedside, you introduce yourself to the patient, provide privacy, and explain what you're going to do. To do trach care, the supplies that you need will be a tracheostomy kit, and you'll have to look to see if there's a suction catheter in it. In this case, we're going to have our own suction catheter, a towel, hydrogen peroxide, and sterile water. Now, to prepare my work area, I like to have my table perpendicular to the bed. I like to have a trash can right here where I can drop my soiled items in. I raise the bed to be comfortable for my back, and I elevate the head of the patient to facilitate breathing. After I raise the head of the bed, I'm going to lower the side rail, and I'm going to remove the pillow, and this will just open the area for the neck so that we can have more working space and the patient will be more comfortable. The next thing I'm going to do is remove the soiled dressing. So to remove the soiled dressing, I just need clean gloves. And just say, okay, Mr. Smiley, I'm going to remove your dressing. You want to pinch it up to try to get all the drainage that you can out from underneath the tracheostomy because it's probably pretty soiled. So you pinch it up, fold it up in your glove, remove your clean glove like you've been taught to do, and throw it away in the trash can. The next thing I'm going to do is I'm going to put on the towel across the patient's chest, and this is not a sterile field of any sort, but it is to protect the patient's gown and bed from anything that may inadvertently launch from the trach during trach care. And you'll know what I mean when you do it. Next thing I'm going to do is turn on my suction. Since it's so loud, for demonstration purposes, I'm not going to have the suction on, but in real life, you bear in mind you're going to have to work over that noise. Okay, I have my table set up, I have my trash can, I have my supplies. I think I'm ready to open. How do we open a sterile package? You always open a sterile package away from you. And we do the same thing with our trach care packages. We look and see what all's inside our package and how we're going to have to do our work. First thing I'm going to do is pick up the sterile gloves and put them over to the side. I'm going to pick up my sterile drape to prepare my sterile field. Remember, whenever you pick up a sterile drape, to always pick it up along the shiny edge. You have 1 inch around the drape to work. Always walk around your drape, never shake to get it unstuck. Lay it down on your table, shiny side down. If you accidentally put it shiny side up, that's okay, but it's designed to be shiny side down to collect any wetness that may land on there during trach care. You want to open your solutions, and always remember, whenever you open a solution, you want to open the bottle and put the cap up. Okay, I'm going to open my suction catheter into the middle of my sterile field, opening it away from me and dropping it right in the middle. I'm going to dump the contents of my trach care kit into the middle of my sterile field. Just dump it out, put my tray back down, and then I'm going to pour my solutions. I reach around my sterile field and I pour hydrogen peroxide in one of the containers, in one of the sections, and then I reach around and I pour sterile water into the other. Okay, and then I ask, is there anything else I have to do before I put on sterile gloves? I don't think so. I think I'm good. So I'm going to put on my sterile gloves. Remember, when you're putting on sterile gloves, that the packages are designed to, you should put on your gloves the way they're laid in the package. Now, I noticed that I'm slightly contaminating my field here, so I'll be sure and not allow anything to go over in that area. I'm going to pick up my first sterile glove, open it up, put my hand in palm side up, being careful to only touch the inside of the glove when I'm putting it on my hand. I'm going to get the second glove with my gloved hand, and I'm going to get a good grasp of it. And then again, I'm going to put my hands in, palm side up, only touching the outside of it this time. Okay, my hands are sterile now. I'm going to organize my work here a little bit, get my dressings separated. I like to separate my little 4x4s like little cocktail napkins, just so I can easily reach each one. I have my sterile catheter, my supplies, and I'm just laying them out in an orderly fashion so that I can reach over and get what I need. Now this is my trach ties. They can go anywhere because they don't have to be sterile at all. Okay. Mr. Smiley, I'm about to suction your trach now. I'm going to take my non-dominant hand and contaminate it by picking up my suction catheter, my suction source, and then I'm going to pick up the suction catheter. I'm going to maintain control of my catheter. I don't want it flopping around. And then I'm going to attach the suction catheter to the suction source, and then I'm going to make sure it sucks, and just put your thumb over it, and that's how you apply suction. Suck, unsuck. Okay? When you're suctioning a person, you want to introduce the catheter far enough to go past the trach. You want them to cough. You may bump the carina, and if you do, that's more than far enough. As soon as you get it in far enough and you hit soft tissue and they begin to cough, you can begin suctioning. Now I'm going to show you, when you remove the suction catheter from the patient, you want to do it in kind of a back and forth twisting motion so that the holes will suction the lumen of the inside of the trach. The other thing is, when you're inserting and removing the catheter, you don't want to touch the trach itself, and you don't want to touch the patient's chin, and you don't want to touch anything. Okay, you go in without suction and out with suction. So here we go. We want to introduce it quickly without touching anything, and I'm in far enough now. I'm going to apply suction. I'm going to remove the catheter. Notice the twisting motion, and I'm kind of crawling it out. The reason I'm crawling it out is to maintain control of my catheter. Okay? I'm going to notice the secretions. If they're really, really thick, I can just get a little bit of that sterile saline there to loosen it up. After the patient's recovered, I can suction them again. It usually takes twice. So again, I insert without suction, insert quickly, may bump the carina, apply suction, again twisting back and forth, crawling down the catheter, maintaining control of the catheter. Okay, after I've suctioned, I want to listen to him, see how he sounds. If he sounds clear, I'm going to just put my catheter down and not worry about that. If it falls on the floor, that's okay. We're not going to use it again.